Good day to everyone, and I bring warm greetings from the Philippines and from the Social Innovation in Health Initiative Global Network, as well as from the CHI Philippines Hub. Indeed, this is a privilege to join this interesting discussion today on digital health innovations. And my presentation is entitled Social Innovations and Digital Health, the CHI Philippines Experience. And I will be sharing stories from the ground on social innovations in digital health that were co-created and implemented with our partner communities and that worked in the Philippine context. Let me start with a disclosure that I have no potential conflict of interest to disclose. And also by introducing the Social Innovation in Health Initiative, or we pronounce it as CHI, as for forward and upward looking. We are a global network that was established in 2014 and builds upon 50 years of multidisciplinary research and community engagement in public health interventions from TDR, or the Special Program for Research and Training in Tropical Diseases. During the past 10 years, the Social Innovation in Health Initiative Network has cultivated a committed network of hubs that are based in research institutions and have substantially increased social innovation research and capacity, especially in low and middle income countries. CHI Philippines is part of this growing global network that's currently composed of 13 CHI hubs that are present in 4 regions. So we have 6 CHI hubs from Africa, that's in Malawi, Uganda, Ghana, Nigeria, South Africa, and Rwanda. 4 hubs in Asia, that's where Philippines is part, plus China, Indonesia, and India. And another 2 hubs in Latin America and Caribbean, that's our CHI hubs in Honduras and Colombia, and a CHI hub in Sweden. The network is coordinated and managed by the CHI Secretariat in the Philippines, ensuring synergy, sharing, learning, and reaching out to new partners. And through this global network, we endeavor to embed social innovation research in other countries as well. The CI hubs have been established worldwide and are strategically situated within academic and research institutions, and they are dedicated to advancing community-engaged social innovation in health through research capacity strengthening, including social justice, gender equity, and advocacy. And through the advocacies of the CHI hubs, they champion social innovation and convene all stakeholders to nurture ecosystems where innovations can thrive. CHI Philippines, where I am a part of and I'm the lead, is a hub that was established with the belief that the health of all Filipinos can be improved through creative and innovative solutions created by all Filipinos. So we were first established in 2017, and it's currently hosted at the University of the Philippines, Manila. And just this year, actually specifically tomorrow during the University of the Philippines National Institute of Health anniversary celebration, we will be launched as a program on social innovation and entrepreneurship in health under the Institute of Clinical Epidemiology at the National Institutes of Health, or NIH, at the University of the Philippines. This is a very important milestone for the CHI Philippine Hub, and this also coincides with the 10th year anniversary of the CHI Global Network, and I'm excited to share with you today some of our important milestones also. We joined the country's endeavor towards healthy Pilipinas and achieving for all, health for all through what we call sama-samang paglikha. That's a Filipino term for co-creation. So first, how do we define social innovation in health? In the network, we define it as a solution. So it could be a process, a product, a practice, or even a market mechanism that's implemented through diverse organizational models. The solution has been developed by a range of response to a systemic health challenge within a particular geographic context. It profoundly challenges the current system status quo, and they should enable healthcare to be more inclusive, effective, and affordable. In short, we also define social innovations in health as inclusive solutions to address the healthcare delivery gap that meet the needs of end users through multi-stakeholder community engaged processes. So if you will notice, we gravitate more really on the participation and the active participation of the community as important stakeholders. So since 2017, we have been conducting activities under 4 focus areas. So we identify and conduct research on social innovations in health. We strengthen capacity on research and practice of social innovations. We design and deliver workshops and educational tools. We also connect innovators and partners to each other and even to resources and social innovation. And we advocate for knowledge translation and uptake of research innovations to contribute to the country's health research and policy agenda. Just to give examples of social innovations that were identified already in the country, to name a few, we have the Inter-Island Health Service Boat Project. That's an integrated boat referral system that connects remote village health centers to the municipality's main birthing facility. This social innovation has been able to improve access to maternal health services, such as facility-based deliveries and skilled birth attendance, bringing down maternal deaths and infant mortality to zero. And this is very important, especially in island municipalities in the country. Other social innovations are the National Telehealth Systems, or the NTS, the 6.60 pesos Everyday Family Health Plan, and the Seal of Health Governance, or SOHG. And if interested, you can read more about this in our website. That's www.socialinnovationinhealth.org. Now, moving on to social innovations related to digital health, we also have several. So first off, it's using human-centered design approaches to develop innovative models for delivery of essential health services in 3 Philippine rural communities. We did this study during the COVID-19 pandemic sometime in the late 2020 to 2021. We also applied human-centered design for local telemedicine system in southern Luzon, Philippines. It's one of the major archipelago in the country. We also advocate for fostering multi-sectoral learning and communities of practice through the development of a social innovation in health learning exchange, or what we call Innovex platform. And lastly, we also facilitated the co-creating geographic information system-based mapping for communicable and non-communicable diseases, monitoring and surveillance through participatory action research. And I'll be sharing stories in these 4 social innovations in digital health. So first is using human-centered design, or HCD approach, to develop innovative models for delivery of essential health services in 3 partner rural communities during the COVID-19 pandemic. As we all know, the COVID-19 related health system disruptions brought about changes in the delivery of health services. And you can imagine just what happened, especially in far-flung remote areas. So the project aimed to document patient and health provider experiences and co-create innovative strategies with the community in accessing essential health services during the COVID-19 pandemic restrictions. So during phase 1, we did key informant interviews. We had focus group discussions and local health indicator review. Of course, all these were done with precautions, following government protocols also. And during phase 2, we had co-creation activities. We introduced human-centered design thinking. We had patient journey mapping. We had World Cafe activities, prioritization grid, pilot testing, and feedback mechanism. So it was a bit challenging during this time because the pandemic was still going on. But during these conversations, 3 main themes emerged. So health systems delivery disruptions, local government response and adaptations, and co-creation of a referral pathway that has led to a pilot session wherein community health workers were trained in the use of a 2-way radio. So the municipalities were an island municipality where internet connection was very problematic. So what they came up was the use of a 2-way radio, which all of the municipalities had, because these municipalities were prone to a lot of typhoons. So this was their common denominator. And so they said, why not use this for medical referral? So participants confirmed the appropriateness and the ease of use of the intervention. The human-centered design activities facilitated the co-creation of an innovative pathway that's shown in the screen right now, which is a blend of a telemedicine platform and engagement of volunteer community health workers as teleconsultation facilitators. So the effects of the digital divide were observed in comparing the accessibility of healthcare providers and the patient, and this was most prevalent in remote, underserved areas where internet and network connectivity is sparse and intermittent. So what we see in the screen right now is actually an output from conversations and workshops with the community, and this is how they would want the flow. So this is now merging the telemedicine and what they actually do. And so they say that this one is workable on their end. So the second project that we had is applying human-centered design for local telemedicine systems in one of the major archipelago in the Philippines at Southern Luzon. And in 2019, the Philippines Universal Healthcare Act was implemented, and this includes assurance that Filipinos will have access to healthcare provider networks, whether through health facilities or remote digital technologies. So the Department of Health in one of the region launched its telemedicine for Southern Luzon project. And as part of the capacity strengthening endeavor, they partnered with us in a 3-day training workshop to apply the human-centered design for the telemedicine system. So the workshop was co-designed and co-developed and co-delivered by the University of the Philippines, Manila's Medical Informatics System, and the Social Innovation in Health Initiative, Philippines. It was attended by representatives of rural health units, district hospitals, and provincial hospitals from provinces in this particular region. Their challenge always was, even if they have the technology, when it comes to implementing it in the communities, there's always this gap. So the question now is, how do we bridge that gap such that these resources and technology will be maximized even at the community level. So the activities of the 3-day workshop were organized to follow the 3 phases of the human-centered design approach, namely inspiration, ideation, and implementation. As part of the output of the workshop, they were able to produce telemedicine service flowcharts for provinces and monitoring plans, and technical inputs and guidance on designing provincial telemedicine systems were also appreciated and now being implemented in that particular province. So the third is establishing online platforms, which is essential in fostering communities of practice among social innovators in health within the Philippines. To address this need, the Social Innovation in Health Initiative Philippine Hub collaborated with 2 other groups, namely the Make a Difference Foundation and the Zulig Family Foundation, to develop an online platform known as the SIH Exchange Platform, or we call it Innovex for short, to facilitate the exchange of ideas and resources among stakeholders. So how we did this, we facilitated a consultative workshop which was conducted with key stakeholders and potential end users to elucidate the platform's functional and technical requirements. So participants included 15 policymakers, community health professionals, social innovators, NGOs, and academics. So we also did World Cafe. This is a participatory approach wherein attendees go through different stations and have free-flowing discussions regarding the station topic. So the stations, each of the stations talked about website design, access, engage and exchange, and study and learn mechanisms. So after the workshop, identified design features for the platform, where increasing capacity for research and documentation of social innovations in health, consolidating funding opportunities, and finding partners to scaling health innovations. All right. So as an offshoot to this Innovex platform, as a result, the stakeholders' engagement consultations were able to co-create and develop the online Innovex platform, which was funded by the Philippine Council for Health Research and Development, and this was launched in November of 2023. At present, one of its major use is it's an exchange platform for communities of practice, sharing, and peer learning in accelerating the implementation of the universal healthcare law in the country. So this approach stems from the cohesive community during capacity strengthening interventions and learning circles conducted by Zwillig Family Foundation, a partner of CHI, through their local health systems programs, namely Bayang Malusog. So Bayang Malusog in English means Healthy Nation. They have leadership and development programs for universal healthcare. So the initial interventions gain momentum as key stakeholders openly share their challenges and best practices, fostering a collaborative atmosphere to achieve UHC deliverables. So the universal healthcare learning circles, the brown bag sessions, the learning conferences, and technical sessions in partner areas have become platforms for this exchange. And recognizing the potential for faster and more equitable health outcomes, Zwillig Family Foundation has formally institutionalized this collaborative effort, or the Bayang Malusog Communities of Practice, in partnership with CHI Philippines. So we're using now the Innovex platform for the communities of practice, and we have the tagline BMX, or the Bayan Malusog Exchange. Lastly, CI Philippines have also facilitated co-creating geographic information system-based mapping for communicable and non-communicable diseases, monitoring and surveillance through participatory action research. And this is a research proposal by one of the research partners of the Philippine Council for Health Research and Development, or PCHRD. Phase 1 aims to collaboratively design wireframes for a community health monitoring mobile app and collect comprehensive baseline data on health indicators in the local area. So following the principles of community engagement and shared decision-making, a community advisory board will be established with diverse representatives, and through focus groups, interviews and design workshops with the community advisory board, the needs, challenges, and desired features for a new health monitoring system will now be assessed. And this last one is still in a work in progress, but we hope that the social innovators will be successful in making sure that their GIS-based mapping is relevant to the needs of the communities they will be serving. We also strongly advocate that for every research project to contribute to policies that will strengthen local health systems, improve access to health services, and improve health outcomes. As an example of this is CHI's Community Engagement Self-Monitoring Strategy Project that was eventually translated into a local ordinance by one of our partner communities. And they were able to expand this not just in health, but also in education, agriculture, and even in their tourism program. So that is also our dream for all social innovations, especially social innovations in digital health, that this will be institutionalized and funded by the local government and even by the national government. I think in all the projects of the CI Philippines that I've shared in digital health, our major key takeaway is it's not that the communities are against technology, but actually what we found out is technology can be transformational when it empowers people to co-create innovations that provide practical solutions to their everyday challenges. And we've seen that in all these 4 projects that we have had in partnership with the communities. So on behalf of the CHI Philippines team, we would like to thank the conference and all of you for this privilege and this platform for sharing our experiences and social innovations in the CHI Philippines Hub. So thank you very much and maraming salamat po.